Australia sending thousands of COVID vaccine doses and millions of personal protective equipment items to PNG as the country struggles to contain a surging outbreak of the virus. I'm joined now by former diplomat, now Liberal MP Dave Sharma. Dave, you spent time in Bougainville in the Peace Monitoring Group, also in the High Commission in PNG in your early days as a young diplomat, but you know that country well. And it's facing a crisis right now.
It is. This is one of the most serious crises Papua New Guinea has faced. They're an incredibly tough and resilient nation and people, and they've been through a lot from natural disasters to wars. But I think what we've seen, the figures with COVID-19 in the last few weeks is really alarming. And I think we're right to be concerned as Australia, and the world should be concerned.
So far, the Pacific has done incredibly well. The islands, certainly, island nations, largely free of it, but PNG was always looming as the real risk, and now it's proven to be correct.
Yeah, look, PNG is quite different in the sense that it's much more populous, about 10 million people in Papua New Guinea versus a few 100,000 in most of the islands. It shares a land border with Indonesia, which means there's a lot more, movement of people and goods and whatnot than some of the remoter Pacific islands. And look, the country as such, it's so mountainous and rugged and isolated in places that it's quite hard to get testing kits, medical equipment, doctors, healthcare facilities to a lot of the country. So it's a difficult place to govern at the best of times and provide services. And I think you add in COVID-19, it's a whole other level of challenge.
I spoke to one doctor who works in PNG, and he said that topography doesn't necessarily mean the virus won't travel, because while it might be hard to get the vaccines in and so on, PNG citizens, they still travel around. They meet family in different parts of the country. So they travel,
yes,
but it might not be able to that easy to get logistics and supplies in.
Look, and particularly with these vaccines that need to be kept at very cold temperatures and used within a certain period of time and administered in a certain way. The cold chain, if you like, in Papua New Guinea is not well developed. A lot of the goods still move around by light aircraft, but usually what they call PMVs, minivans basically, that go up and down the Highlands Highway or along the coastal roads, or boats in a lot of the islands, just small boats. So actually deploying the vaccine there is going to be quite challenging, and we've always known that to be the case.
One of the points that's been made, obviously the health system is nothing like we have here, sadly, a developing nation, but it's also got a younger population, so hopefully the virus won't have the same sort of devastating impact it might have in other countries.
Yeah, look, hopefully. I mean, we've seen that, interestingly, in India, where the caseload has been very high, but the death rate has actually been quite low, and we don't really know quite what the reason is. It doesn't seem to be a different variant, but they've got quite a young population in India too. That might help Papua New Guinea here. But you see, I mean, of the cases, tests that they did in the first week in March in Papua New Guinea, 17% of people are tested positive. And I think Port Moresby General Hospital, which I've been to, you've probably been to, it's the main hospital in Papua New Guinea, fully half of healthcare workers there have tested positive for COVID-19. So this is why the priority for our assistance is to help the healthcare workers and the frontline workers get protected so they can continue to do their job with the rest of the population.
And for the EU now, the Prime Minister sent a very clear message: release those doses that we've paid for, and he wants them to go to PNG. It's a good aspiration, but I mean, they've got their own problems in Europe.
Look, they do, and I think this has been the challenge with getting vaccines from Europe. But I think we've got a pretty compelling moral but also strategic case about we don't want this to get out of hand in Papua New Guinea, because, as we know, this is a global public health challenge. It's not a national public health challenge. And if any one country, spirals out of control in this, it's going to end up rebounding on all of us. So I hope Europe will listen to, the forcefulness of our arguments and the common sense proposition that this is an urgent case of assistance that's needed, and they should respond quickly.
As a long-serving diplomat yourself, talk us through the nuance in the message that the Prime Minister and Foreign Minister gave today, because they were very keen to say, look, this is a partnership with PNG, this is not a handout, so to speak. We're working with PNG and we're listening to what they're doing and helping them in that regard.
Look, absolutely, that's critical. I mean, Papua New Guinea is, like a lot of countries, very protective and proud of their sovereignty, and it's important that whatever we do to support them, it's done with them, not to them. And I think this is why our Prime Minister was very careful to make sure he spoke to Prime Minister Marape, James Marape, his Papua New Guinea counterpart, before making this announcement, and to make sure that whatever we were providing meets Papua New Guinea's needs. And I think this Australian medical assessment team that we're sending over as part of our assistance package, which will go and do some needs analysis, will work quite closely, hand in glove really, with PNG authorities to develop a package of assistance. But I think we need to be clear here that Papua New Guinea is the lead actor here, and what we're doing is to try and support them.
One final question. It was interesting the Prime Minister also made reference to Quad partners assisting in this. It seems to be taking a more elevated presence, the Quad leaders, obviously since the leaders' dialogue, but, working in the humanitarian space. It's not just about hard power necessarily. No. They're talking a lot about soft power, i.e. help in a humanitarian sense.
Well, it's interesting because the origins of the Quad were actually after the Boxing Day 2005 tsunami. This is when this constellation of countries, India, Japan, the United States and Australia, first came together. It was basically to do humanitarian assistance and disaster relief in the wake of that devastating regional tsunami. And it's interesting that 15 years later, we're coming together, same group of countries, to again respond to a humanitarian crisis in the region. I'm
about to go to Greg Sheridan from The Australian, get his thoughts on a bit of this, which I'm very interested to hear what he thinks on this too. But with the way that it was born, the quadrilateral security dialogue, correct me if I'm wrong, but it was Kevin Rudd. He pulled out of it, didn't he, at one point?
Yeah, I think it was.
Why was that? Was that due to his worry that China would be offended by it, or what was it?
That was basically the reason. Stephen Smith, who was the foreign minister at the time, at a joint press conference with the Chinese foreign minister, announced that Australia would not be involved in this initiative anymore. So it was done as to mollify relations with Beijing, but without a view to Australia's strategic interests at the time.
Dave Sharma, thanks for your time.
Thanks, Kieran.
Appreciate it.